Healthcare is at a crossroads in Connecticut. We need a big picture plan to address the healthcare challenges. In this session, the legislature is considering a number of important healthcare bills. I ask our state leaders to think carefully about how some proposals to address today's challenges can make it impossible to realize a long-term vision of improved health and high-quality, sustainable healthcare in Connecticut. I ask that you incorporate components of Senate Bills 810 through 815, as well as House Bill 6938 and Senate Bill 916 into an omnibus bill, and here's why. Although close to 1/3 of Connecticut's budget is spent on healthcare, and healthcare costs have been rising faster than incomes for the better part of 2 decades, currently we have no state entity officially responsible for facilitating health systems planning and design. We're uncoordinated and siloed in our approaches. We are at once trying to improve coverage, access, quality, and affordability, and at the same time, letting economic forces drive decisions that may undermine those very efforts. To change this counterproductive trend, we must start with the end in mind. The bills you're hearing today address many of these problems, but they don't pull it all together. You have the opportunity to address this now, so you don't have to come back later to fix unintended consequences. An omnibus bill, crafted jointly by legislative leaders with input from affected stakeholders, including consumers, providers, and payers, can be written to ensure that stitched together, the various bills in fact add up to visionary, strategic, and sustainable solutions. I have 3 brief points in support of this. First, we need a unified vision of the health system of the 21st century in Connecticut, and to align initiatives in support of that vision. We have a volunteer healthcare cabinet and SIMS steering committee, and an administrative Office of Healthcare Access, but we have no entity in Connecticut officially responsible for facilitating health systems planning and design. We need alignment of the various initiatives and resources, data for performance improvement, and accountability for results. Vermont, Massachusetts, Oregon, and Washington State all have an authority that looks at healthcare as a whole system. They are all trying to address the triple aim, which gets me to my second point. The triple aim is a vision for a system that improves the experience of care for patients, improves the health of populations, and reduces per capita costs of healthcare. We should ask ourselves how the healthcare bills on the table help achieve the triple aim. The hospital crisis is being treated so far as a technical problem of access to capital to construct buildings and create new high-profit service lines like cardiac and cancer centers, perpetuating the same unsustainable hospital business model. In reality, the question is, what kind of hospital care system will our state need over the next 30 to 50 years, given our changing demographics? With 7 in 10 newly insured Connecticut residents now in Medicaid, we'd better figure out how to improve the cost effectiveness of the Medicaid program. That doesn't mean having the program perpetually on the cutting block. It means truly achieving the triple aim for the people it serves. It means paying better for preventive primary care and cutting-edge ways to access specialty care. It means better accountability of the program for improved health outcomes. It means making the experience of care of people covered through Medicaid equal in quality to that paid for by good commercial insurance. We can learn from the experience of other states like Vermont and Oregon. My third point, we need to ask the right questions and identify what we really should measure to know the true results government, nonprofit, and for-profit players are achieving in health and healthcare. Data is important if we ask the right questions. Please exercise caution that proposed bills addressing a health information exchange and all payer claims database don't create unintended contradictions or duplication. Connecticut's federally funded healthcare innovation model will be using nationally validated standards and quality measures, plus some that we in Connecticut want to measure, like health equity, in the context of creating a statewide network of advanced medical homes and a shared savings program to align payment with quality outcomes. This major undertaking is ultimately supposed to involve 80% of the state's population. We need to substantially improve HIT capacity for collecting and analyzing these data if we are to achieve the model's goals without creating unintended consequences. To conclude, Connecticut is facing serious health system crises. Let's make this an opportunity to create a bold, compelling vision for health and healthcare that can favorably benefit the state's people and economy well beyond today. The triple aim is a worthwhile place to start.